Now, without further ado, it is my pleasure to welcome today's first speaker, Scott Morano, Senior Vice President with Ipsos's Healthcare Practice. Scott, you have the floor.
Thanks so much, Ellen, and thanks to all of you who are attending. We're so excited to share this information and our point of view with you. This is a really important, really exciting area. It's important to all of our clients across sectors. It's important to all of us as people and for the people in our lives. And so we're really happy to share some of the research that we've been doing recently with patients and with consumers, and to really talk about the context and what we see potentially coming over the next year or so. To take you through a little bit about what we'll be covering today, I'll start with some context about obesity and weight loss medications to just kind of level set with what these things are and why they're important. I'll take you through some of the recent research that Ipsos has done around general interest in weight loss medications. And then I'll pass it to Shireen to talk about the near-term implications of weight loss medications and what we see as the potential for the uptake in the near term. All right, so with that, why do we care about obesity? So on the next slide, this is a breakdown of our population in the US, and it's shocking if you haven't seen this data before, but 74% of Americans are classified via the BMI as being either overweight or obese. Someone is classified as clinically obese if their BMI is at 30 or higher, and that represents 43% of Americans. Another 31% of Americans fall into an overweight category. So this is the prevalence of obesity. It's a problem that covers well over half of our population. And as far as why obesity matters and why it is such a serious health condition, obesity is related to many other serious conditions. It typically precedes any of these conditions. Whether or not obesity directly causes them, it certainly is something that appears in advance of a lot of these conditions. Things like depression, asthma, sleep apnea, high blood pressure, high cholesterol, cardiovascular disease, type 2 diabetes, cancers, osteoarthritis, fatty liver disease, PCOS. All of these are conditions of varying severity that represent, in some cases, lifelong conditions. And these particular things that happen after obesity are important to mention because, doctors believe that even 5 to 10% of weight loss can improve these conditions or maybe prevent or reverse them in the future. So treating obesity earlier in the process can help really improve people's lives going forward and improve their health. And so that's kind of a very high level view of obesity. Let's talk about the new treatments for obesity that you've heard about. You might have heard them described as GLP-1s, which is the class of medication they are. These aren't a new thing. This is it's based on a hormone found in nature that was first discovered in the 1990s, based on the venom of our friend here, the Gila monster, which is a native of my Arizona. And they've been used in treatments for type 2 diabetes as far back as 2005. The first medications were twice daily injections for diabetes patients. The first GLP-1s that were approved for obesity treatment, with or without diabetes, came in 2014. The medications we're talking about now that are generating such interest, like Wegovy, like Ozempic, like Mounjaro, those are newer once-weekly medications that are much more effective, not only at treating diabetes, but at providing really staggering amounts of weight loss with a very improved tolerability profile. And so that's what all of the buzz and interest has been around that particular medication, all thanks to our friend, the Gila monster. So I'd like to take you through some of what we've heard from consumers in the US. In our recent Ipsos consumer tracker, which we fielded at the end of October, we asked people if there was a safe and effective treatment for weight loss, would you be interested in such a medication? And we found 54% of consumers in the US were very or somewhat interested in a weight loss medication. Would like to take you through the groups that are most interested to kind of present a profile of who we're talking about when we're talking about people interested in weight loss medications. Looking at gender, women tended to be more interested in weight loss medications than men. We also find that in age ranges, the millennial, younger Gen X category in that 30 to 44 age range tend to be the most interested in weight loss medications. We're also finding folks with an income over 100,000, so a little bit higher income, tend to be more interested in this kind of medication. We see that while all race and ethnicity groups are interested, Hispanic Americans indicated the strongest interest. Our people who are married were more interested than those who are not married or partnered. Also, we find people with children in the household are more interested in a weight loss medication than those without children at home. Primary grocery shoppers, so that's something of particular interest for a lot of you who might be on the call today. Primary grocery shoppers are also much more interested than those who do not have that primary responsibility in the house. And lastly, at Ipsos, we do like to look at differences by political affiliation. We see a lot of opinions that are formed on a tribal basis, and for some reason, people who are Republican or Republican leaning tend to be more interested than Democrats or independents. So with all of that said, this paints a picture of a consumer who's more interested in weight loss medication if they're a little younger, more likely to be women, maybe married with kids at home, maybe higher income, and they're doing the grocery shopping. This doesn't take into account whether they're eligible for weight loss medication. We do not have information about whether they're obese or overweight or what that status is. It's just kind of in general, are you interested? We wanted to look at attitudes about obesity among those who are interested. And what we find is that pretty much everyone unanimously agrees that obesity is a major health problem in the US today. We asked about if they believe that new medications are showing potential to treat obesity. And while majorities of Americans believe that, there's a 20-point gap between those who are interested in medication. And interestingly enough, our consumer tracker data found that those who were interested had quite a bit more awareness of all of the different potential weight loss treatments. So they are showing signs that they're engaged in the category. Lastly, we see a majority of Americans believe that obesity is a disease, but that belief is again a 20-point gap between those who are interested in medication and those who aren't. So there is a feeling that obesity is a disease, but for those who really believe that more strongly, they are more interested in medication. I'd like to kind of take a pause here because part of the issue that we want to address and look at is, what's the uptake for these medications going to be? What kind of impact will it have going forward for our clients and for our country? And one of the things that might potentially pump the brakes a little bit on that level of interest is the feeling about the economic outlook in the country. It's not really a secret to any of you that the general outlook right now is not great. This is some data from the Ipsos Global Inflation Monitor. This is the US data from late October, which again surveyed 1,000 adults. And we find over half of Americans telling us that they're either struggling right now or just getting by. We have 42% telling us that they believe inflation will be here to stay and won't go back to a more normal level for at least another year. And then we see 71% of Americans expecting the cost of their groceries to increase at least a little, if not a lot, in the next 6 months. So the general outlook, people are feeling very conservative about what's happening in the economy and a little concerned about it. If we take a step back and look at the consumers we talk to in our consumer tracker, looking at those who are interested in weight loss medications versus those who aren't, we actually find that group that's more interested. So again, the millennial women, married, kids at home, even with a higher income, they're really much more conservative about their economic outlook. They are in a saving cycle right now. They're spending money on food to cook at home rather than going out. They're saving more for the future. They're saving more to treat themselves, but they're wanting to save money, not spend it. And if we look at the next slide, this is even more clear when they're telling us they're not looking to spend, they're postponing spending on big ticket items, on vacations, on needed repairs. They're even telling us they're postponing medical treatment. Hopefully that's not life-saving medical treatment. Hopefully it's more elective things. But certainly the signs that we're getting from the folks who are interested in medications are that they're in particular, and again, given their life stage, they're more likely to want to save money than spend money right now, at least in the near term. So with all of that context, I will turn it over to Shireen to talk a little bit about what we see as the likely impact of GLP-1s in the near term.
Great. Thank you, Scott. So you're all here for a reason, and that's really to try and assess what the impact of GLP-1s are going to be on your businesses, right? So for this next section, there are a few things that we like you to keep in mind with regards to GLP-1. First of all, we have seen a recent uptick in the adoption of GLP-1, but the increase is likely slower than what the social media hype would suggest. Second, lack of access and insurance coverage, along with high costs for the patients, have really limited the use of GLP-1 specifically for obesity. But we are seeing, to the third point, we are seeing new access points that are offering lower price alternative, and this could help drive the adoptions of GLP-1 in the future. So we'll delve into each of these a little bit more. First, what we did is we did some social analytics using our Ipsos Synthesios platform. We took a look at the online mentions specifically for Ozempic, Wegovy, and Mounjaro. And not surprisingly, right, we see this really big uptick, especially for Ozempic since the beginning of the year. Now, it's important to keep in mind that Ozempic is synonymous with kind of GLP-1. It's like the Kleenex or Xerox for the GLP-1 category. So not surprisingly, that's the one where we see this tremendous growth compared to Wegovy and Mounjaro. Okay. Now, despite this increased hype, if we take a look at the actual usage, so prescriptions of GLP-1s, the overall usage remains pretty low. Now, we do see a similar trajectory in terms of the curve, that uptick since the beginning of 2023. But if we look at Wegovy, which is specifically indicated for obesity, right, it's really at that, about 400,000 prescriptions as of September. So not tremendous. Thing to note for Ozempic and Mounjaro is this is total prescription. So it's inclusive of diabetes as well as, off-label use for obesity as well. But overall, penetration remains low. Now, taking a look from our Axios Ipsos American Health Index, which was fielded in August of 2023 this year, we did ask Americans if they've used a prescription drug specifically for weight loss, and only 5% reported that they have done this. Okay, now think back to the slide earlier on when Scott shared about eligible patients. It's really about the 70% plus mark, right? So 5% of 70% is very low penetration, and that's what we're seeing here. And the reason for the low penetration is a lack of insurance coverage, along with high out-of-pocket costs for patients, have really limited the adoption specifically for obesity. Medicare doesn't cover it for obesity. Medicaid does, but it varies state by state. So there's a lot of variability there. And when we take a look at commercial health plans, we've seen statistics ranging from 20 to 40% of them covering GLP-1 specifically for obesity. Now, it's important to keep in mind that coverage does not equate to low cost. They do offset some of the costs, but a lot of that cost also gets passed on to the patients themselves. So there's still this high out-of-pocket cost for patients. So what if they qualify and they get a prescription, even if they have coverage, they may or may not be able to afford it, okay? But what has happened with the social media hype is that it has certainly increased awareness and certainly interest in the category, as we've seen in the data that Scott shared. And what that's led to is these health plans feeling more pressure than ever before, right, to cover it if they haven't already. And we've seen, intent or interest in more of these health plans considering to cover it in the near future. However, this is one of the biggest barriers, And where it nets out, we really don't know. It is a huge unknown, but it is an area that we are very curious to see how it plays out. So let's throw some figures on the board here, okay? So various market analysts estimate that the GLP-1 market potential, specifically for weight loss, could reach about 150 billion, dollars per year by about 2030 is what I've seen. So that is a really big figure for health plans to really take on, if you think about that. Now, on the flip side, if we take a look at the total annual cost in the US that's caused by having obesity or excessive weight, that comes out to be a cost of $1.72 trillion. And this is 2016 figure, since that's the last time the Milken Institute did this type of analysis. So you can imagine that in 2023, this figure has gone up significantly. So when you take a look at the figures on this on the slide, right, the math makes sense. But healthcare is a very conservative and complex industry, and there's a lot of things that need to occur before this $150 billion market potential can be realized. And the other thing is that it's going to take a long time. It's not going to happen next year, nor the year after. It's going to take a considerable time before it actually can recognize that potential. Another reason that the adoption has been slow is that there's been stocking issues. So in the beginning of the year, along with the social media hype, we saw that uptick, right? The makers of GLP-1 have really struggled to keep the products on the shelves. And the latest status for the 3 products of interest, we see that the 4 lowest doses of Wegovy is still currently on a limited availability due to high demand. Okay, what this means is that there will not be a lot of new patients starting the Wegovy because the only one that's readily available is the highest dose, and patients are not going to start on that mainly because of tolerability concerns. Okay, now for Ozempic, we see that the highest dose of Ozempic is also on this limited availability, at least through the end of this year. And the highest dose, and this one's indicated for diabetes, right? So the highest dose also equates to potentially higher weight loss. And that's the one that's on limited availability. So again, for weight loss, we may not see too much more of an uptick given the limited availability status. Now, the third product, Mounjaro, after experiencing shortages in the beginning half of the year, it is now readily available in all doses. So we would expect to see continued increased use of that brand across all doses. Okay, so those are the factors that's been limiting adoption of GLP-1s. And what we see now is that there are new access points that are offering GLP-1s, and they could become more and more prevalent, especially as consumers seek more access to healthcare in general. So what we're seeing is that these medi or wellness spas, really more in the retail space, along with digital health startups, they're emerging, they're including GLP-1s as part of their service, and some of them are offering GLP-1s at a much lower cost as an option as well. Now, the thing to keep in mind here is that some of these low-cost alternatives could come with questionable quality because these aren't the ones that are coming. These aren't the branded version that are coming from the big pharma GLP-1 makers. The most likely sources of these low-cost alternatives are coming from what's called compounding pharmacies. When there is a drug shortage, these compounding pharmacies are allowed to make these products, even though they're still on, protected by patents, they're allowed to make it because of drug shortages. So from that perspective, whether or not they're going to be allowed to continue making it once all dosages of the GLP-1s come off that FDA shortage list, that's another thing that we're going to be watching out for. Okay, so consumers, what's happening here is that they're making access easier with these new access points. There's low-cost alternatives being offered as well. We've seen consumers who are interested in GLP-1s based on what Scott had shared with us earlier. Even though there's high interest, we want to emphasize that interest does not necessarily equate to actual purchase. Again, due to that economic outlook and their focus on savings, right, and less spending. So when you think about GLP-1s, and where it falls in terms of the list of necessities, it's not really as high as some of the other product categories that we've shared with you earlier on. Okay, so that's what's been happening in the obesity and GLP-1 marketplace. As we summarize the factors that are impacting adoption, I think it's really good to look at the public sentiment towards GLP-1s and obesity in general. And so again, taking a look at our American Health Index that was conducted in August of this year, obesity is seen to be a huge threat to the American public health. It's number 2 to just opioids. So it is a serious issue that people recognize. Now, in the same survey, we also asked them whether they support or oppose to the use of weight loss medications for those who aren't eligible. And most of them do not feel, most of them actually are very strongly opposed to the misuse of weight loss medications. Now, taking a look at social analytics and the online commentary, to date, we've heard a lot of hype, mainly positive, right, for the GLP-1 category. When we take a look at the actual mentions online, and this is from the past 2 years, we actually find that most of the commentaries are generally neutral. Okay, and there's actually more negative sentiments than positive sentiments when we took a look at this analysis, particularly for Ozempic, which again is kind of synonymous with the category itself. Now, when we double click and take a look at the negative sentiments, the top 3 mentions were around the product shortages, mainly in the beginning of the year, where again, people who aren't necessarily eligible were getting the product, taking supply away from people who actually did need the product. There's also concerns about body image and the message and lack of and possible backlash in terms of acceptance of various body types. Those were also included as well as far as negative sentiment goes. And lastly is, again, speculations with the celebrities and other figureheads who are using it, but probably should not be. And those are other areas where a lot of negative sentiments were found online. Okay, so as we look into the future, right, we've actually boiled it down to 3 key factors that we feel will influence whether or not there's going to be a broader market adoption of GLP-1s. The first one is around access. Now, historically, right, patients would have to go see their physicians. The physician would then do their assessment, give them a diagnosis and a prescription if appropriate. So really taking a look at the physician offices, as a gatekeeper. But as we mentioned, right, there's these new access points that are coming in the form of retail as well as online channels that are making access much more accessible. The second factor is around affordability. Okay, we talked about the lack of coverage, and even though there could be coverage, the out-of-pocket cost is still very high. That's passed on to the patient, right? So that's also limited. But with these new access points, some of them are actually offering very affordable options and promoting that aspect of it. But the one thing to keep in mind here is that there are lawsuits in place from Big Pharma against some of these compounding pharmacies. So depending on what those outcomes of these litigations are, that will really determine which way this particular factor will swing, if it's going to kind of keep to the right with the traditional, or if it's going to become more readily available. Okay? And the last factor is what we're calling around eligibility, right? So eligibility being the specific indication as approved by the FDA, and really reserving it for those folks. But it's worth mentioning that healthcare has been in this transition phase for a while, where in the past, you know, the patient, conditions would be treated by a specific specialty. For example, a patient would go see an endo, and get their diabetes and most likely the obesity part as a weight aspect get treated. But then they would go see a cardiologist, right, for their high blood pressure or high lipids. What's happening now is that there's more of a comprehensive care team in place. And that care team is made up of different specialty, because what we're trying to do is not just focus on taking care of a specific condition, but taking care of the patient as a whole. Because a lot of these patients do have multiple conditions, and it's more effective and efficient if there's a comprehensive care team treating all these conditions. That leads to more efficiency, right? So our belief is that for the consumers, for a lot of these consumers who are eligible for GLP-1s, many of them will probably benefit from just behavioral interventions. And what we mean by that are diet, exercise. It's very commonly accepted that that certainly does. Those two things certainly impact weight, right? But working with a dietitian, having a continuous coaching, team to help you manage and checking in with you. For many consumers that are overweight, perhaps even obese, this could be enough. And with that being the case, then the GLP-1s will be reserved for those who really, really need them. What that means is that people who are more genetically predisposed to being overweight or having obesity, those who are more immunocompromised, who have, more likely to develop comorbid conditions. So really reserving those the GLP-1s for those that really need them, and thereby not giving it to everybody who's necessarily eligible, but really again, the most effective ones, right? And that would translate to a more limited financial burden for health plans and the overall healthcare system. Okay, so that's kind of what's happening. We're not quite there yet, but it is slowly happening. We are seeing that transition take place. Now, on the flip side, what we're calling it for those who want it, right? So they may not necessarily be eligible, but they're interested in it. If they have the want and they have the means, there's ways for them to get it. So you think about people who go outside the U.S., right? Medical tourism is actually, quite big to get elective procedures that aren't covered in the United States, right? We hear stories about people going to Canada to purchase medications because it's so much cheaper there. So for people who want it, whether they're eligible or not, and they have the means, if there's a will, there's a way, right? So just to summarize, we highlighted these three key factors. Now, where these factors land, we don't know, but certainly the implications are very broad and profound within healthcare as well as outside, especially if we see that shift really moving more towards the left-hand side of the slide. But healthcare is a very complex and slow moving, industry. There's a lot of barriers in place. And so for things to change and shift, it does take time. Now, when will these things happen? Really, no one knows, right? It'd be great if we had a crystal ball, but we don't. So our goal here was to really identify, the key drivers here, and identify what the most likely scenarios can be for each of these aspects, and then for you to monitor and plan for these scenarios so that you can be ready to adapt your strategies accordingly. Scott, back to you.
Thanks, Shireen. I do want to note that we're very proud to have shared a lot of the analysis and tracking and various research that Ipsos has done is publicly available. I also want to reference 3 new syndicated studies that we have launched and are currently available. These are the PDFs that are in the handouts. I keep wanting to say show notes like this is a podcast. It's not. But in the handouts, you'll have information about these 3 syndicated studies. The first is available now. It's an obesity and cardiometabolic disease therapy monitor. And that includes surveys with HCPs as well as real world data to really understand what is happening in the treatment of obesity and cardiometabolic disease. Our second study, we're currently fielding right now, so the data won't be available until February, but that's a tracker designed to understand consumer perceptions and attitudes towards obesity and understand the awareness, consideration, and use of these kinds of medications. And so that's, again, we're fielding that now, so that will be available in February. Our last study is still in the design phase. This is our GLP-1 market sizing study, where we're looking to understand from an HCP perspective the actual use of GLP-1s across different therapy areas to understand how those prescriptions are shaping out. So please take a look at those if you're interested and let us know. We're happy to take you through like what the plans are. These will be global studies that are starting and can be, we have room for custom questions to be added to them as well. So it's a very cost-effective way to get some additional answers. So with that, I think we'd like to see if we have any questions that have come in. I see a couple, 2 or 3 that we have. So the first one, you seem more conservative about the GLP-1 outlook from the general population perspective. As pharma researchers, what is your opinion about these drugs? Well, that's a good question. I will go first because Shireen spent most of her time waxing poetic about things and I just had numbers. So I will start with my opinion. I actually think that these drugs in particular, the semaglutide, the tirzepatide, these are life-changing medications. These are drugs that will have not just as treatment for diabetes and have a huge impact on people with diabetes, but the treatment for people with obesity is massive. It's, you know, prior medications before these were approved, you would maybe see 2, 3, 4, 5% weight loss that would potentially be gained back. This is showing data upwards of 20, 25% weight loss, which is enormously life-changing for so many people. And not only that, we're seeing signs in trial results and in trial designs that there's potentially like a cardio protective component here where it can potentially stave off stroke or heart attack, where there might, you know, there certainly could be benefit to fatty liver disease, which has been untreatable to this point. There's potentially treatment options for chronic kidney disease, for Alzheimer's disease, for some cancers, and even for alcohol dependency. There's a lot of areas where this drug can go, just given like where it's working in the body, hormones in the brain, hormone receptors in the brain, in the gut. It's gonna be there. It will continue to see these kinds of drugs come to market and grow and develop in terms of the impact they'll have on people and on society. And I think that they are really tremendous medications that will be changing people's lives. Shireen, I don't know what you have to add.
Yeah, no, I mean, I agree with all that. I definitely think that's the case. I'm going to add a little broader perspective. Since COVID, digital health has really taken off. For those of you who are in healthcare or have been following healthcare, we're really in a transformative stage right now with regards to healthcare and approach. It's an exciting time to be in healthcare, and I kind of touched upon it, where I said. Physicians, they used to treat individual conditions, right? So there's this movement, and this is a term, I can't take credit for it, but I heard it, is there's a movement from sick care, right? Which is, we get sick, we go see the physicians, to actual health care, which means that, there's this more holistic and earlier preventive approach towards health and wellness. Right. I think in the past, healthcare is healthcare. That's when we get sick, right? Wellness is like, before that. there was very little overlap, but we're really seeing this overlap between health and wellness because it really does lead right into that healthcare aspect. And one of the things that's also helping support this is that the incentives are in place for clinicians and their health teams through value-based care. So the incentives are aligned to treating the patient and not just the individual conditions anytime somebody gets sick. So that's really exciting to see. And, that's applicable to all conditions, but especially for weight management, which is something that earlier interventions has tremendous right benefits and effect on the overall health for a person as they get older and whatnot. And so that does equate to lower financial burden for health plans and the overall health systems. So yes, there's a lot of benefits to GLP-1s that Scott just talked about. And so we do anticipate there's going to be broader use of that for new indications. But again, with more tools and the earlier preventative approach, a lot of these more expensive drugs will be used for when they really are needed and reserved for those who really need them, because they are prescription drugs, right? So you do need to weigh the benefits with the side effects. Not everyone's appropriate or can tolerate them. So that's some of the things that we do see happening in this aspect.
All right, we've got another one coming in. I've seen lots of CPG companies raise alarms about changes in shopping and buying patterns. What's your take on that? Shireen, do you want to go first for that one?
Sure. I mean, certainly a lot of interest. We've seen a lot of headlines from retailers and CPG companies about this. We've seen, unfortunately, the stock prices, drop after a couple of announcements and whatnot. You know, we've shown you that the overall penetration for GLP-1s is still remains low. We talked about the barriers in place that's kind of limited that thus far. But of course, what does the future hold? We don't know. But again, in healthcare, things don't move very fast. So any impact, will take some time to get to. Now, for those who have been on GLP-1s, for weight loss and have, very positive experience, I think it was Walmart who published saying that they've seen changes in purchasing patterns there. So for the small segment of patients who haven't, it certainly works. And so the impact can be profound. But then I go back to saying, how long will it last? Because this is a lifelong treatment. Once you go off of a GLP-1, the weight does come back, right? So they do need to keep on it, right? They have to be able to continue affording this. And how long does that last? And in terms of, people are creatures of habits. So I imagine that even for those where it is very effective thus far, there will be a proportion who will stick with it. But there will also be a proportion who kind of maybe fall off of it. And so I still think, that's TBD, for sure. But thus far from what we observe, it's just been a very small segment.
Thanks. I agree with Shireen's take. I would add to that kind of on a different way to answer that. We saw in our consumer data that among those that are most interested in weight loss medications are primary grocery shoppers. And what they're telling us through this data that we shared earlier is that they're interested in ways to lose weight, but they also want to save more money and spend less. And they're really concerned that prices keep going up. So there might be an opportunity for our CPG clients to provide healthier or less calorically dense products and options that aren't premium priced. I know there are some categories where, like a full fat soda and a diet soda are priced the same. There are other categories where a full fat chip and a baked chip are not priced the same. There's probably some, this data suggests to me there's some unmet needs there with people who are interested in a way to have weight loss, but aren't really in a place where they're willing to spend or able to spend additional money for that. So those are questions to bring up with your insights partners, see if there's anything there, but that's what the data says to me anyway. The last question I think we'll have time for, why aren't more insurance plans covering obesity, especially if a majority of Americans believe it is a disease? I will take a crack at this first, but Shireen, please give the hook if I start going too far. I think, we saw, I think around 60% of Americans say obesity is a disease. And what that means is there still is a huge chunk of society that believes it's a moral failing, easily solved if you would just eat right and exercise, full stop. And I think that's pervasive. I think, whether that's at the broad society level, at the insurer level, some healthcare providers, policymakers, there still is a sense where we don't need to pay for treatments for this. People can just pull themselves up by their bootstraps and lose the weight. I think until public opinion demands it, I do believe insurers will be slow to really treat it as a disease, because they'll be, in my opinion, they'll be kind of slow walking this because of the near-term costs. That slide Shireen shared where you have the near-term cost to cover obesity treatments, and then the longer-term costs for the follow-on health effects for not treating obesity. The short term might really outweigh it. So I think until it's treated in the way that we provide coverage for high blood pressure, for diabetes, for asthma, until it's treated like that, I think there will be that push and pull where some plans will cover it and others won't. And until we actually get over that hump where the majority are covering it, I think it will be a challenge. Shireen, I hope I didn't go too far, so walk back if you
Not
need
at
to.
all. Yeah, no, not at all. No. I'll take it one step further and kind of pontificate a little bit here. Yeah. So yeah, the coverage aspect certainly has been, a big contentious point, right? Particularly for something like as sensitive, a topic as obesity. Um, there is more of that short-term focus. I think as humans, we tend to be able to see the short term rather than the long term a lot of times. But again, if we do take a longer term focus, right? So the short term, yes, there's a bigger investment in terms of covering it for the members. Now, these members may end up switching to a different health plan because of different employers or whatnot, right? But if we collectively, if the health plans collectively come together and cover it, right? Again, for those who really, really need it, not necessarily broadly everybody, but talking about that stepwise treatment approach I've talked about, then as your while you're treating your members now, and they might move to a different plan, right? The reverse is also happening as well, where they're on a different plan and they're covering it for the short term, but the long term benefit, they could be switching to your plan and in the long run, and then you get it. So if there's more of a status quo in terms of this coverage, on a broader scale across, the industry, then it becomes almost a net win-win situation because there is the movement. So, again, I think it's important to think the longer term in this case, because the short term might, cost you more in the short term, in the long run, actually. So.
Wow is all I can say. Shireen and Scott, that was a lot of data, a lot of interesting insight, and thank you for such a wholesome, comprehensive presentation. Thank you everyone for joining us today. We likely did not get to your question because there were so many. And so do please expect to receive an email with a direct response to your question. And you will also receive a direct link to today's recorded presentation so that you can revisit and share it. Additionally, there are some handouts in the control panel for you to download that relates to some of the research that we shared today. And of course, at any opportunity, we welcome the opportunity to speak with you, so please reach out to us directly. That now concludes today's webinar. Have a wonderful day, everyone.